You're on the air. What's your question, please?
Tell me the bottom line. What does it cost, and do I get multiple discounts for many members in the family?
Okay, and you, after that, you had a comment about that you had sent to me earlier, this is Lanny Shupp, by the way, about COVID and the benefit of having a personal person guide you through if you have COVID. So I'd like for you to address
Sure.
that too.
Okay.
Thank you, Lanny.
Sure, thanks for the question. The cost is $1,800. Again, it's an investment.
That's
in health.
annually, I would assume, right?
Pardon? Annually.
Yeah, annually.
Yes. So it works out to about $5 a day. So you think about your specialty coffee. If you think that's valuable to have, then you want to invest in your health. That covers the executive exam. So it's obviously not going to be for everybody because of cost, but I do think that the value, you just have to consider that value. I see dependents up through the age of 26. So if somebody has kids age 10 through 26, I see them, there's no fee for them, okay, in terms of an annual fee. And spouses, we still charge the same amount. So sometimes they'll cycle that through. They'll say, you get it this year, I'll get it next year. So that's the fee structure of it. In terms of COVID, I think, COVID is so scary, honestly, folks. It's a scary disease. It goes all the way from mildly symptomatic all the way to death. And it's killing a lot of us in our communities. To have one person that you can go to for information, to bounce back and forth. Some of the questions that we have to answer about COVID aren't simply yes nos. Mm-hmm. It takes time to interact. People have concerns. People have questions. Where do we go? And I think that having the time to do that. I mean, part of the worst thing is the unknown in medicine. We don't know. Exploring that and teasing that out is so important with our patients, and so having that is really important.
I often tell people, take an advocate with you if you're going to a doctor for some of these real fast in and out.
Very important.
And you're
point.
the advocate if somebody has COVID, because I know the hospital's saying in the first 10 days if a person's diagnosed, they can get the Regeneron, the monoclonal antibody infusion. That's life-saving. And to have someone like you who diagnoses it immediately and makes sure they get that infusion.
Just had that discussion today.
Yeah.
But
Just
even
have
more
that.
life-saving than that is to get the vaccine.